Good morning. I want to thank you all for joining me. And we're going to take a virtual coffee break. I've got my cup of, well, actually it's water in here. No more coffee for me this morning. So I just want to have a chance to follow up on a lot of questions and calls I've been getting on one topic in particular, and that is the budget and how it's going to impact Medicare and Social Security. So as you all know, President Biden released his budget proposal last week for the coming year 2024, and it builds on the progress Democrats have made over the past 2 years. So let's review that, right? We lowered prescription drug costs, we created more good paying jobs, and we combated the climate change crisis in a very dramatic way. And we invested in our infrastructure. So the plan is a reflection of our priorities while ensuring that we pay for this by the wealthiest taxpayers paying their fair share and returning corporate tax rates to what they had been for decades before the Republicans lowered it drastically. As many of you know, I'm a senior member of the Appropriations Committee in the United States House, and that means it's my job to carefully review all the requests from the president, compare them to the funding needs that have been requested by the agency leaders, and then make sure that we're listening to groups and organizations that contact my office, the nonprofit sector here in Minnesota, and of course, the needs of the American people, constituents like you that I represent. So we put forward through the president an official budget proposal, but the House Republican majority has not done that yet. And we need to get that from them as soon as possible in order to get to work. We need to shape 12 individual appropriation bills that fund the government. Now, as I said, Democrats, we've done our job. Our Democratic proposal for a budget is out there. They need the Republicans to show us theirs, and they need to show it to you and me. The American people are owed that budget document to look at. What we do know, however, is that the Republican Party has a long history of attempting to privatize Social Security. And even some, like Senator Rick Scott of Florida, have stated that they're willing to put out a proposal to take devastating cuts to Social Security and Medicare. And we know that millions of Americans depend upon Social Security and Medicare to retire with lives of dignity. Even those who have said that Social Security and Medicare cuts are off the table, they have struggled when we've asked questions on how they will exactly preserve these two important programs while they attempt to expand tax cuts for the very rich. Now, we've all paid into those programs. You paid into those programs. Our fellow Minnesotans have paid in. And you've all earned the promise of economic security and healthcare, and it needs to continue. And I want you to know I'm going to fight to protect what you have earned. And earned is the right word for this. You've earned it. The president is also fighting these proposed programs, and he has put forward, as I said, in a budget that reflects our values. But I have to tell you that the Republicans, from what I've seen in the House, are aligning themselves with the extreme budget proposals like the Center for Renewing America proposal. Now, let me just give you 3 examples of what they're proposing in their budget. Eliminating the Low-Income Energy Assistance Program, referred to as LIHEAP, that keeps the heat on for people, especially seniors, when we see high energy costs go up. So LIHEAP is something that we depend upon here in Minnesota in the winter, especially people on fixed incomes. Second thing that they want to do is put seniors and families at risk of food insecurity by decimating nutrition programs like the Supplemental Nutrition Assistance Program, referred to as SNAP. They tried to do this back a couple of years ago. We fought it back, and we fought it back with seniors like many of you helping us say what that would mean to your daily food and nutrition intake. And then, believe it or not, they want to take away disability and healthcare benefits from our veterans, greatly restricting which veterans are even eligible to receive VA healthcare, and then severely restricting direct disability payments for those who have served our nation. So you can learn more about these extreme proposals. They're out there, and how they place the interest first of large corporations and the wealthiest Americans above others. So we'll have some information on this. If you want to contact our office, it's called the Commitment to End Woke and Weaponized Government. And it is their budget proposal. So this is the draft document. Many Republicans in the House and some of them in House leadership are talking about, where they're getting their ideas from. So you can take a look at that. But if that's not bad enough, they've also, the Republican Party is saying that they're willing to hold our economy hostage for the debt ceiling vote. And they're using that as a way to put Social Security and Medicare back at the table to discuss and put it on the chopping block. I want to be clear. Lifting the debt ceiling is about paying for past obligations, many of them that occurred during the Trump administration and because of the Trump tax cuts. This is not about future spending. The debt ceiling is not about future spending. And as I said, thanks to the GOP tax scam, which cut the wealthiest taxes and for large corporations under the guise that it would spur economic growth to make up for the loss of revenue. But instead, it accumulated trillions of dollars of debt. We've seen this before. This does not work. And once again, Democrats are trying to get the economy back moving again and do it in a way which is fair to everyone. So when President Trump had issues with the debt ceiling because of his tax scheme, Republicans had no problem lifting the debt limit. They did it 3 times during the Trump era. So the bottom line is the US should not default. It would be a disaster for our economy, for Minnesota families. And I want you to know Democrats are committed to paying their bills on time. We'll roll up our sleeves and we'll continue to work on behalf of the American people. Let's just, as I said earlier, take a minute or two to talk about what's at risk here. Just think about what we've accomplished in the past few years. We passed the bipartisan infrastructure law, which resulted in thousands of good-paying jobs into the future. We're working on fixing our aging roads and bridges. And, we know here in Minnesota, I drove into work this morning, I was avoiding a lot of potholes. So we know we have infrastructure that we need to fix. We also passed the largest ever investment in fighting climate change in the Inflation Reduction Act, really moved forward in the US taking a major role in making sure that we're more resilient with our infrastructure, but also what we're doing what we can to work to stop the devastation of climate change. We also capped the price of insulin. That was huge, $35 a month for Medicare beneficiaries that allowed, and in there, we allow for Medicare to negotiate for drug prices, which will lower prescription drugs for so many Americans. So I want you to know, I bring those up again because I'm proud of what we've accomplished so far. But I know there's more to be done, and it will continue to work with President Biden to finish the job. He said it in the State of the Union speech over and over and over again. There's more work to do. So next week, I'm going to go back to DC. And I'm ready to get back to work to finish the job. Now, I am going to get to questions. Thank you so much for submitting them. But I want to tell you what I have going on this week. So after I'm done with this, later on, I'll be going up and meeting with Speaker of the House from Minnesota, Speaker Hortman, and I'll be testifying in front of the Minnesota Senate about a fabulous new way in which we can grow jobs and prepare our state to be forward moving in its economy in the future. And so if you want more information on BioMaid, please go to our website. Now, tomorrow, what I'm most excited about, though, is I'm going to be with a large group of elected leaders, government employees, environmental organizations to discuss the Mississippi River, what needs to be done to protect our most vital resource. The Mississippi River, well, it plays a vital role in all of our lives. I grew up on it in South St. Paul. It's not only a working river, but it's a place for families to enjoy and recreate. And it's no surprise to many of us here in the Twin Cities that it's the source of drinking water for 20 million Americans. And it's tied not only deep to our history, but to Native American culture. It is a sacred place of origin for the Dakota people. The health of this great river continues to be at risk. and extreme weather events, pollution, and runoff all play a role in that. And that's why I'm proud to be reintroducing legislation in Congress that will establish the Mississippi River Resilience and Restoration Initiative. We're calling it MIRI for short. This initiative will coordinate conservation and environmental restoration along the entire river corridor, from the tip of it in Minnesota all the way down to the Delta in Louisiana. So I'm excited about that. And I keep referring to our website. If you're not getting updates, you have to sign into the website. You have to join the website to get our newsletters and find out more about what's going on. So please do that. I know many of you already do, but for those of you who haven't, please consider that. So now we're going to, as we're working on MIRI, is listening to experts and community leaders about the challenges this river faces. And we're going to discuss what we can do to work together to protect the river for future generations. So I'm going to work to protect the river, but I'm also going to work to protect water. So thank all of you for your support you've given me in the Boundary Waters Wilderness Canoe area legislation that I'm working on. So my district office stands ready to work for you. And just call us if you have any questions, concerns, Social Security, Medicare, prescription drugs, veterans benefits. We're here to work for you. But now I'm going to take some of the questions that you have put forward to us. And so Elizabeth is going to help us with that. Elizabeth.
Thank you. So first up, we have a question from Gwen in St. Paul. And she wanted to know, how much do you want to increase Social Security benefits? And do you want to reduce or eliminate taxes on them?
Well, thanks, Gwen. My main focus right now, as I think you can tell from my remarks, is to protect the benefits that all of us have paid into and have earned. And we're going to be working to protect that and not let Republicans move to reduce those benefits in order to balance a budget to provide more tax cuts for the ultra wealthy and large corporations. Here's something that recently did happen. There's a law that was put into place, and it's called the Cost of Living Adjustment. It's a COLA required by law. And so, for example, on May 1st, 2023, the benefits for Social Security increased 8.7%. A lot of that was due to inflation. So Republicans are talking about rolling back that benefit. We're not going to let that happen with the Democrats. And President Biden's made it very clear he's not going to allow that to happen in legislation. He has a veto pen. On eliminating taxes, Minnesota is one of 11 states that taxes Social Security benefits. And there's bills under consideration in the Minnesota legislature this year about lifting that. And I'm going to be up there talking on another project for new manufacturing for the future biomade, which is clean green chemistry rather than using petroleum-based chemistry to produce our products. But I'm going to be up there talking to our legislators, and I'm sure this will be a topic of conversation. And I'm going to tell them that we've heard my constituents that we would like to see Minnesota state taxes eliminated on Social Security. There's also a great MinPost clip from March 2nd, and it provides an update on the status of this legislation. It explains how some Minnesota leaders want to keep the tax in place for wealthier folks who can afford it. So there's different tiers that people are talking about with this plan about eliminating the taxes. So stay tuned. I know I will be doing just that. And you can contact your state representative. And here again, our office can help you with that by you providing us your address.
Thank you. So next we have a question from Martin in Woodbury, and he wanted to know what Republican members of Congress have stated that they would like to cut Social Security and Medicare.
So as I said earlier, we don't have an official proposal from the House Republicans under Speaker McCarthy's leadership, but we have seen Republicans like Florida, Rick Scott, with proposals out there, and it was called the Rescue America Plan. I don't know how you're rescuing America by not letting seniors keep what they've earned and retire with dignity. So what we've been saying as Democrats, it's time for Representative McCarthy's conference to show us how they propose to make these deep cuts to domestic spending and keep Social Security and Medicare intact, increase the defense budget. They need to show us their plan. And until I see their plan, I'm not going to trust the fact that they, in a soundbite or on a screenshot at the State of the Union, stood up for Social Security and Medicare. I talk to Republicans all the time, and they're telling me it needs to get scaled back. It's too large. And then, as I pointed out, the proposals from the Center for Renewing America, the Republican Conference Committee, would make devastating cuts to these programs. And, you know, the Republicans have aligned themselves with these proposals in the past. All of a sudden, they've gone silent, but they haven't rejected them. So we'll be seeing what's going on. And that's why we need to ask, you know, show us your plan.
Thank you. Next, we have a question from Judy in Stillwater. What is your plan for securing Social Security and Medicare without cuts? And she says that we need to keep pension plans funded. Well,
thank you for that. And it was my honor to work with the retirees to stabilize some pension plans. And there's more work to be done in that area. But just Social Security for a moment. You know, Social Security and Medicare, they, believe it or not, are essential to our economic growth. And so we must keep them funded, as well as safeguarding pension plans to ensure seniors can retire with dignity. Because when people are stressed or they can't make ends meet, that's not good for our economy. So it's in our best interest to honor the commitment to take seniors' healthcare and their basic standard of living and make sure that it is protected, because you earned it. So here are some ideas. One idea that we have that will be absolutely fabulous for Medicare, and it's smart and something I proposed for a long time, is expanding Medicare's ability to negotiate for drug prices. That would cut federal spending by $160 billion over 10 years. Just imagine that, just negotiating for prices like other countries do, and like the VA does. So it'll save money for seniors and will allow the federal government to apply those savings. That's one way we can, you know, help shore up Social Security and Medicare. I also support President Biden's plan to increase taxes on the wealthiest taxpayers. And let's be clear, we will ensure as Democrats that no one with an income under $400,000, I don't earn that much. Not many people in our district do, will not see any increases in their taxes. So the minuscule people who are impacted by this will just be paying their fair share. As the president said, there is no reason why someone who is ultra wealthy pays no taxes, but yet a firefighter, a teacher, and a nurse does. His plan also restores the corporate tax rate to what it was before the GOP tax scam, which has caused the deep hole that we're finding ourselves in. These corporate tax cuts have increased the deficit, and they've restored revenues, making massive strides towards a fairer tax system. So that's what we want to do, a fairer tax system, and to level the playing field that everybody pays their fair share into our tax system. And that'll just make America stronger.
So next, we also heard from Leanne in White Bear Lake, who was concerned about our kind of crumbling disease care system and wondering what is being done to kind of shore up our healthcare system.
Well, thank you for that question, Leanne. And let me just start out by saying our healthcare system includes our public health system safety net, right? The Center for Disease Control, the CDC, what we have here in Minnesota with the Department of Health. When we were faced looking at COVID, we realized that we had underfunded and ignored many of these vital structures that we rely on at a time of pandemic, or the same way we do when there's a disaster. We have to make sure that our public health is funded well. And it also pointed out all the health disparities that are still exist even in Minnesota. Even though we strive and try to do better, we still saw how many people suffer because of healthcare disparities, being poor, being a person of color, and being female, all contribute to people not having the health care that they need when they need it. So I would like to see us work and shore up on those systems in general. And quite often we don't talk about that. But I will talk about some things that have happened in Congress and I'm going to continue to work on. I have, once again, and I haven't been able to get a hearing on it, and I don't think the Republicans are going to give me one, a constitutional amendment. It's called Healthcare for All. I believe that if we're going to be serious about making sure, as I said earlier, about addressing disparities, making sure we have a strong public healthcare system, we need to put it in our Constitution that people deserve quality access to healthcare. Other legislation that I know will be introduced or is currently being introduced, or legislation that I'm already on, just to mention a few, there's a Medicare Dental, Vision, and Hearing Benefit Act, and that will expand Medicare to cover vision, dental, and hearing. And it should do that for all here in the country. The state public option allows states like Minnesota to do even more what they want to do and be able to purchase a medical assistance through Minnesota's comprehensive Medicaid plan. So I'm very supportive of states like Minnesota moving forward and doing what it needs to do. John Marty, who's in the 4th District, who I've worked with when I was in the Minnesota House, is a leader, not only on working on many other things, but also working on a state option act, as well as wanting to make sure that we have Medicare, similar Medicare for all here in Minnesota and across the country. The Healthcare Affordability Act of 2021, that revised the tax healthcare premium assistance to expand eligibility to more low-income folks for credits and reduce the cost of healthcare premiums. So as long as we have the system that we have, I'm going to work to make it more affordable for more Minnesotans and more Americans. And then something that's finally come out of the closet. I'm at the age that I remember when people didn't talk about having disabilities like epilepsy, or people who had maybe got diagnosed with diabetes. No one talked about it. Then no one talked about cancer, breast cancer in particular. Well, now we are moving forward with talking about access to mental health. And so we need to make sure that Medicare beneficiaries receive continuous and complete access to high quality health services from clinical social workers. There's a Better Jobs Act to provide more community-based services under Medicare. And then in the Inflation Reduction Act, which we passed, and I already mentioned, had in there to negotiate for better prices for Medicare, but also had the insulin cap in there for $35.
Thank you. We have a question from Stephen in Roseville. He says, are you willing to join a coalition of Democrats and Republicans to accomplish a negotiated solution to the debt ceiling?
Well, Stephen, I'm not aware of this particular group. It might be part of the Problem Solvers Caucus, and I'll look more into talking to some colleagues when I get back in. But let me go back to this again. I don't think we negotiate a solution to paying our bills on time. I think we just pay our bills on time. Lifting the debt ceiling, that's what it's about. It's about paying for past obligations. And the Republicans have done a really good job with their messaging of how somehow saying that the debt ceiling has to do with the budget that we're going to pass now. Of course, we have to be prudent. We have to live within our means. We have to honor the obligations to our veterans, to our seniors, and to others who depend on us being knitted together as a strong community to support each other. But the debt ceiling in particular, we are only one of 2 nations in the world that has created this debt ceiling cliff. And it was originally used to say somebody, this is what the debt ceiling looks like. We're going to pay our bills, but now that we're negotiating the new budget, we need to look at that in real time and see if we can do something so we don't find ourselves being in arrear with our bills. Instead, what the Republicans have done, they put them together and have used that as a way to do these draconian cuts. We need to do a better job of getting our budget done on time, done in public, done with transparency, and we also need to pay our bills on time. So I'll be talking to many colleagues on the Republican aisle who agree with me that using the debt ceiling this way is draconian and it's not what it was intended to do when it was first put into place. I think we have 2 more questions.
We do. Our second to last question comes from Adam in St. Paul. And he wanted to know if you support the discretionary budget authority the president is requesting for the military in 2024.
So I am the lead Democrat on the Defense Appropriations Subcommittee. And it's my job to look at the budget really hard. And I have to tell you, I was not pleased with the radical increases that the defense budget got in the last budget package that was passed. It was way much more money than the Department of Defense, in my opinion, needed. So I'm going to be working with the president and also looking at what ways we can trim down his proposal. But his proposal was radically impacted. One of the reasons why he has, and there's an inflationary increase. And the largest part of the defense bill is paying for people's salaries, their housing, their health care. And we've even gotten involved in making sure that childcare is affordable for the men and women, especially who aren't in the officer corps, that they can afford childcare. So I look forward to hearing from our military leaders about what we can do to remove legacy programs, close bases that we're no longer using, and hold military contractors accountable, which I don't think we do a very good job of for the most part in the defense budget. So I'll continue to be very probing with the questions that I ask. But I do think that the Republicans are even going to try to go above the $842 billion that the president's requesting. And I'm going to fight that, and I'm going to fight that hard.
Thank you. So lastly, we had received some comments. Richard and Joan from Afton wrote in about this. So did Michael from St. Paul about the Willow project that was included in the president's budget.
So in the minute that I have left, I want you all to know I share your concerns about this expanded drilling. We need to be investing in green energy sources. This seems to be a compromise with the Alaska delegation and working with some tribal leaders. There's even a split among Alaskan tribal leaders on this. I don't know that I'll have the numbers and the votes that I need to do anything about this in the House of Representatives to slow it down, block it, or whatever. But I'm going to rest my future on the Inflation Reduction Act, which did amazing things to address how we can end our fossil fuel subsidies, reform leasing programs on public lands, stop Republicans from trying to weaken NEPA, which is the National Environmental Policy Act, and do what I can to protect the environment. So you can count on me for that. And as I said, I'm going up to testify on BioMaid, and BioMaid is a big focus of what that is making sure that we use non-petroleum-based projects as we move forward in manufacturing and making products, making them green, making them clean, making them safe. So we're out of time, and I'm going to, as I said, be heading up to the Capitol shortly here in Minnesota, and then back to DC next week. I want to thank you for participating and submitting your questions. Please don't hesitate. The website's up there, and you can, when you do that, I don't see the website, I just see the phone numbers on there. But Twitter and Facebook and that, sign up and let us know how we can help you navigate the federal system, and comments on how we're doing and how I'm doing in Congress. Thank you for being engaged, and thank you for joining us today. All the best, and watch out for those potholes.